Basketball athletes who get anterior knee pain usually assume they have jumper's knee patellar tendinopathy, but they often have patellofemoral pain. This study looked at this in a large group. It's titled Prevalence and Pain Distribution of Anterior Knee Pain in College Basketball Players. They took 242 players, 138 women, 104 men in the Canadian Inter-University Sport League, so they were all greater than 17 years old. They stood on a 25-degree slant board, their back against the wall, and they squatted on each leg to a range that provoked pain. If there was no pain, they would just squat to 90 degrees of knee flexion. Then they recorded their pain on a pain scale from 0 to 10, and if their pain was greater than 0, this meant that they were in pain. So if they did record pain, they were asked to record their pain using a predefined pain map of the knee area. What they found out of the 242 players was that 146 or 60% of them reported knee pain with the single leg decline squat. And diffuse knee pain was more prevalent, around 71%, than focal pain, around 29%. So diffuse knee pain or patellofemoral pain, which is in these wide areas, was common in both men and women, and focal pain, which would be just along the tendon, was not common in both groups. And if we talk just about the patellar tendon pain right on the inferior pole, this was only 10.3% or 25 of the entire 242 cohort. The researchers sum this up to say these findings suggest that patellar tendinopathy was not a primary knee pain presentation in this elite jumping cohort. What this could mean for you is you need to make sure that you have a patellar tendinopathy and not a patellofemoral pain. Watch my previous video on ways to distinguish the differences. And when it comes to rehab, the patellar tendinopathy can be pretty simple. Get the quad back online, get the calf back online, whereas the patellofemoral can be a lot of different presentations. But you should be looking at the hip, you should be looking at the foot, and you should be looking at general physical preparedness levels.